Chairman, members of the board, I'm Dr. Allison Ansher. I'm the Health Director for the Prince William Health Districts, which includes Prince William County, Manassas City, and Manassas Park. Did you? Oh. Okay. There's 4 common coronaviruses that cause the common cold. They're related to the 2 other ones that we know from history that cause severe infection, the SARS virus and the MERS virus. And that is related to the virus that causes the coronavirus disease 2019. This infection is spread by coughing, sneezing, or close personal contact with somebody who's infected. The specific virus of this current concern has been labeled SARS-CoV-2. The disease it causes is the coronavirus disease 2019, and you may have seen it's abbreviated as COVID-19. Generally, the symptoms have been fever, cough, shortness of breath. Complications may include pneumonia. It's usually in both lungs in the lower part, respiratory failure, and multi-system organ failure. There's a wide range of illness from mild to severe. By looking at data from China, 80% of the infections have been mild and 20% have been severe. The severe infections tend to be in the older population, very much like the influenza virus, as well as people of all ages with chronic diseases, again, very much like the influenza virus. It's believed that the coronavirus is a virus that most likely is in bats normally, and in the past had not been transmitted to humans, but in this instance it had been transmitted to humans, and it's a virus that has not been in humans before. That's why it's called a novel coronavirus. It can be spread by person to person, primary through respiratory droplets if an infected person coughs or sneezes, close contact with other people, which is defined as within 6 feet for greater than 10 minutes, or if somebody has direct contact to secretions that are infected with the virus. Community spread is when people have been infected with the virus in an area, including some who were not sure how they became infected. These are the folks that have no travel history or are not aware that they've come in contact with somebody who's infected. Because it's a droplet infection, meaning that they cough or sneeze and it can drop on a surface, it is possible to touch a surface that has the virus on it, and if somebody touches their eyes or their mouth or their nose, they can become infected. And this is why we're recommending a lot of hand washing, cleaning surfaces that come in contact with a lot of people. Right now, we don't know how long it survives on the surface, so washing your hands frequently and cleaning common surfaces is very important. How our Prince William Health District is responding, just like the county, we've developed an incident management team to coordinate the response and prepare for the escalating event when, in fact, if it does become a community-wide spread. We've also been working with, as outside agencies or nonprofits have requested that we present to them, like Youth for Tomorrow. We've been working with them to prepare, as well as working with the long-term care centers and in the near future with the folks that are not situated in long-term care centers but can go out and about but live with other elder people. As we mentioned earlier, older people are at greater risk for complications from the disease. We've been engaging with the hospitals, clinical providers, schools, and other community partners to raise awareness and provide the most current information. Additionally, we've been in close coordination with our other Northern Virginia jurisdictions, as well as others in the National Capital Region. We would like to try and use the same messages so that people who work and play in other jurisdictions in the National Capital Region but live in our community are hearing the same information. We've been conducting surveillance and investigation of any potential suspect cases. And for the cases, we've been doing what's called contact tracing, interviewing them, trying to find out where they've been, who they may have been in contact with, and contacting those people and making appropriate recommendations depending on the type of contact they had with the case. We've already have been monitoring travelers. If you recall, in the very beginning, travelers from China were brought back to the United States and divvied out to where they live, and we, in fact, monitored 33 people who came back from China. Right now, it's also recommended people who are coming back from Iran be monitored. We get notified by the Centers of Disease Control for the people that are coming back to our community, and provided sometimes adequate contact information so that we can contact these people and give them the appropriate advice and monitor them appropriately. Before I go to this, as you are aware, initially only the CDC could do the testing. In the last couple weeks, the CDC did send out the test and allowed states that were certified, state labs that were certified to do the test, for their state. And our state lab has been doing the test, and the turnaround has been a bit quicker than the CDC. Obviously, as more and more tests are sent to any lab, it takes a little longer to be able to ramp up and get the results. Our lab so far has been able to get the results relatively quickly, a little bit quicker than the CDC. Commercial labs are beginning to test also, LabCorp and Quest, so that should add to the ability for providers to request testing in the appropriate patients. When you ask what the public can do, these are the main things that the public needs to do. Washing their hands with warm soap and water for at least 20 seconds, after going to the bathroom, before eating, and after blowing their nose, coughing, or sneezing. An alternative is alcohol-based sanitizer, but it has to have at least 60% alcohol in order to be effective. Avoid touching your eyes, nose, and mouth, covering your cough and sneeze into a tissue, throw the tissue away immediately, and wash your hands. If you don't have a tissue, they should be coughing or sneezing into their arm so that as not to spread it or have the secretions fly. Clean frequently objects and surfaces regularly with household cleaning spray or wipe. Stay at home if you're sick. If you can, avoid people who are sick. And now we're recommending that elderly people should think about where they're traveling and how they're going to travel and consider whether it's the right thing to do. Again, elder people are more likely to have the more severe consequences from getting the infection. Now, Brian?
Thank you, Dr. Ansher. Good afternoon, Madam Chair, members of the board. My name is Brian Meisner. I'm the county's emergency management coordinator. I'm going to spend a couple minutes this afternoon talking with you about the county's emergency management process and the preparations that we've been underway with for several weeks now leading up to this coronavirus event. So here in Prince William County and throughout the country, we have a local emergency operations plan. That plan is required by state code, and it's a living document, which means that we routinely test, train, and exercise on the plan. So it's not something that sits on the shelf. It's very much something that's part of our culture here in the county and that we continuously train and revise on. And that revision process is underway for the current cycle, so that means we've been meeting even more frequently with all of our stakeholders here in the county. That planning process outlines a whole community effort where we use a functional approach which means we take the different areas of subject matter expertise or resource needs and assign functions to them. And then the main principle that we are using in the EOC right now is a resource management system so that we have unity of effort in coordinating both requests for information that come to us and also requests for resources and supplies that our county departments and agencies may have to meet their needs during this event. We have been monitoring conditions and implementing the recommendations that have been given to us by the health district from the CDC for several weeks. And we've also been coordinating quite closely with our counterparts in emergency management in our other Northern Virginia jurisdictions and the National Capital Region, just as Dr. Anscher has been meeting with her health colleagues regularly. Here in the county, the emergency management program is also responsible for maintaining the county's continuity program. Each department has a continuity coordinator assigned that interacts routinely with our staff. We work with them to develop what are called mission essential functions of the things that we either are required to do by state or federal law or the things that we've prioritized as business practices that we need to maintain operations as a county. This is a process that we also continually revise and revisit, and we actually just started comprehensive updates in January. So again, we've been meeting quite regularly with all those stakeholders, and I can report to you that we have had direct in-person meetings with each of them at least once thus far, and are wrapping up the couple remaining secondary in-person meetings here this week. So we are prepared to enact these plans should it become necessary if the situation warrants or if we receive a recommendation on certain actions from the health district. In terms of what we've done to prepare for COVID-19, we have placed CDC and health district informational signage throughout government buildings and as well as hand hygiene stations to the extent we've been able to source them. There are information rack cards here available in this building and in the process of being dispatched countywide, including to your offices. So you should have those by the end of the day. We've also provided one to the clerk, so you should each have one up there at the dais. We have taken a look at our single point ordering process, as I mentioned, focusing primarily on hand hygiene supplies and workplace hygiene supplies so that we have adequate supplies of those in the workplace. We took a look at the personal protective equipment that our first responders need if they are required to come in contact to someone that's suspected to have COVID on a call. I'm happy to report that we have sufficient supply on hand for the foreseeable future. We also have enhanced the call screening procedures in our Public Safety Communications Center. So if a caller is reporting the three main symptoms, cough, shortness of breath, and fever, they will screen and handle that call differently and make our first responders aware of those symptoms so that they can take actions to protect themselves before encountering the patient or a member of our community on that call for service. And we are continuing to daily assess the needs of our other county personnel that are not public safety personnel who are doing mission essential functions in the community. For example, a child protective services worker, we know those types of welfare checks still need to occur. So we are also looking out for and planning for their needs to make sure that as new recommendations come in, we're able to adequately meet those as well. Just a very brief timeline. There is much more detail behind the scenes here in terms of what we have been doing to prepare and respond, but at a high level, I note 2019 prior, but it's really, again, that continuous process. So we have been updating our emergency operation plan and our continuity procedures for some time. And again, they are quite robust and ready to go should we need them. We did post the initial message to our general public on January 27th on the county's emergency information portal. On March 2nd, we facilitated an EOC policy group meeting with the county executive to give situational awareness to his leadership and also to receive some directives from him on continuity of government. And that is the planning process that we are working on concluding here this week so that we've gone out and touched every single agency on their COOP plan. On March 8th, when we received additional reports of confirmed cases in the National Capital Region, those would be the cases in Montgomery County, we activated our Emergency Operations Center virtually to enhance situational awareness and information sharing amongst our partners. And then on March 9th, upon learning of the relationship to the case on Quantico Marine Corps Base, we also activated our Joint Information Center and the Government Liaison Officer role that you all have been briefed on so that you have that single point of contact. If you have any needs, the Joint Information Center is meant to be our one message, many voices for public information. So anything that the county is sharing or interacting with our partners on comes through that Joint Information Center process. So in terms of public information, VDH continues to be the lead agency. We do have a locally focused emergency operation plan, but as part of that, it is all hazards, and it recognizes that there are certain situations that are dealt with at different levels. This is one of those situations, and nationally throughout the country, the CDC is the lead for responding to this novel threat. The health district is our local point of contact for that, and we are deferring to and using their messaging. I mentioned we have implemented that joint information system. The county's Office of Executive Management Communications runs that for us. So Nicole Brown is our public information officer with her team supporting us in the EOC. And again, just to reiterate, we want to make sure we have a coordinated message, one message, many voices. There are 2 resources on the screen. We are posting all information from the county to the county's emergency information portal. That is pwcgov.org/emergency. The health department has also provided 2 resources. One is a citizen call line. That number is 877-ASK-VDH3. And there's also a website from the health department, and that is vdh.virginia.gov/coronavirus. And with that, Dr. Ansher, I would be happy to answer your questions.
I just want to add, it's very important that people go to reliable websites for information. There's a lot of rumors, false information, people trying to make a buck. So it's really important that the CDC website or these websites are the ones that people in our community use. I also have a fact sheet for each of you on the coronavirus. I don't know if I'm allowed to step up and, oh, thank you.
Thank you so much for your informative presentation. Are there any questions from the dais?
Madam Chair,
Supervisor Bailey.
thank you so much for your presentation. Really appreciate it. Appreciate your immediate responsiveness to the Marine Corps, and regards from Colonel Bentley and that fashion as well. In terms of the Ferlazzo building, where Supervisor Margaret Franklin and I are located, the provisions that are made there, could you just highlight those for us, please?
Sure. So in the Ferlazzo building and in all of our county government facilities, including our parks and recreation facilities and our libraries, for all those facilities that receive janitorial services through our public works department, we have ensured that they are completing their regularly programmed cleaning procedures for wiping down contact surfaces. For the buildings that did not receive janitorial services every day of the business week, those have been increased, so every building is being touched every day. And in all of those high-traffic facilities, particularly where we have public counters and folks coming and going throughout the day, all surfaces are being wiped down at least 3 times a day.
Madam Chair,
Supervisor Bailey.
I heard there was bleach and antibacterial coming. I didn't see it, so that's why I was asking.
Yes, ma'am. So we are in the process through that EOC single point ordering system of getting that divided up and dispatched out. We do have a rather robust environmental chemicals program through our risk management office, and we're working directly with them. We do have sufficient supply on hand. A lot of it is bulk chemical that has to be diluted down into the individual spray bottles, so we're working through that process as we speak.
Thank you so much.
Yes, ma'am.
Madam Chair.
Supervisor Kalyn.
Thank you very much. I think, and to your point, Doctor, is depending on the channel that you watch or the show that you watch on that channel, we're either going to go back to the Stone Ages here soon with this, or it's something that we shouldn't even be talking about. I suspect it's somewhere in between those extremes. But I guess I'd like to understand this a little bit better if we have some data. Is this more concerning than the flu? Because I was looking at your presentation, and we could each year cross out COVID-19 for flu and give the same presentation. Is it something that is more concerning for our elderly or population that have respiratory conditions than the normal flu would be? I guess I'm trying to understand from an expert here on why this threat level has risen so high that it's now more concerning than the flu would be to our community.
Part of it, we don't know the complete epidemiology, I'll be honest with you, but part of it is the fact that with influenza, some people have either some immunity to the new strain that comes out the next year. And in fact, if you remember with H1N1, surprisingly, elderly people did better than children, perhaps because they had been exposed to various influenza viruses, so they didn't get the big whammy. The theory now children may be doing better than adults because they have, they're germy and they are exposed to a lot of coronaviruses with common colds and whatnot. And so that may provide them some protection. I think the biggest issue is there's a lot of unknown. Initially, there was no immunity. It's a brand new or novel virus, just like H1N was. So there's no immunity. It takes time to figure out the epidemiology. To be frank, China wasn't very open with information initially, and perhaps we'll find as it does spread throughout the community, and you see more milder cases as opposed to seeing all the severe cases where, unfortunately, a lot of people died, the rate that people die may be less. But yes, in fact, older people and people with chronic diseases, just like influenza or this strain of influenza that we have this year, and more commonly that occurs with influenza, are at greater risk. So a lot of, to be honest with you, a lot of the preparedness is bringing out and dusting off the pandemic flu plan, and lessons learned from that with social distancing, closing of schools, et cetera. Not that I'm implying that that's going to happen. I want to be clear, but those kinds of processes, what worked, what didn't work, are going to be used if necessary.
Okay, thank you.
Madam Chair,
Supervisor Lawson.
thanks. So, Dr. Ansher, I take that as a yes, to a degree, to answer Supervisor Kalyn's question.
At this point, more children die from the seasonal flu than at present in the United States that have been negatively impacted by this virus. But again, we haven't seen it widespread, and we do have widespread flu. I think a lot of the concern, there's a lot of unknown.
Okay, and then if you wouldn't mind, there may be others in the room that don't know what you mean by the epidemiology or whatever that word was. So
Okay,
could you help me
sure.
out with that?
How it's transmitted, how long it
Okay.
takes between the time you get infected, that you're
Okay.
infectious, or you're infectious.
That's part of the
before.
unknown?
Well, no, now we're basing it on the other coronaviruses, MERS and SARS from the past, and it appears as if from the cases we've seen, the incubation period is anywhere from 2 days to 14 days. That's why you hear when they isolate people, quarantine people. And quarantining means that you're separating someone who is not infectious but has been exposed. That's why we do it for 14 days.
Madam Chair,
Supervisor Bailey.
thank you. I just want to assure with the Marine Corps, the communique, make sure that the communique comes from us to them directly in terms of what's happening down there.
Sure, thank you.
And I'm asking this because they're in my district. I want to make sure I'm doing my job.
Yeah, thank you, Supervisor Bailey. So in terms of the communication process, because that case is on a Department of Defense installation, they are the lead coordinating entity. They have reached out to the health district for help checking those contact traces that may be off base. There is no confirmed information to share or report from any of those investigations, and that's for people's privacy. So we are in contact and in support with the health district, but we haven't had any specific requests. We definitely stand ready to do so if that arises.
Thank you.
Madam Chair.
Supervisor Bodie.
Thank you, Madam Chair. And thank you so much for the presentation. This is very timely. Obviously, we have a lot of folks in all of our districts that are very concerned about this, especially since we have a high population of folks that travel all around all the time. This is a very transient area in terms of people traveling for work, for the defense industry, what have you. The other consideration that I've had is the ripple effect this has on other folks that are treated for other things. So, for example, we have some folks that, for example, they need home health care. for example, or they have other prescription meds that keep their respiratory issues under concern. And we've heard that some other localities, some other states have given some concessions in terms of pre-authorization for those types of meds, given more resources to home healthcare workers to help deal with this. One of the biggest concerns I've heard is just the amount of time it takes to test folks and the amount of resources there. So what has been happening on the state level, if you could speak to that, coordination with the county to sort of deal with those issues?
Well, I heard on the news this morning that CVS is going to allow people to not have to pay if they run out of medicines, that they'll be able to order, so often it's 30 days, 30 days, 30 days. So they're going to allow them to do that. I assume if CVS does that, others will probably follow. I can't speak for the CDC, the federal government. It does take time to develop a test. You have to make sure it's accurate. That does take time. It's not easy to ramp up. And before a state lab is allowed to perform the test, they have to perform a certain number and show that they're doing it accurately before it's approved by the CDC. Again, we now have 2 private labs that are providing testing also. The state lab tests, we have certain criteria specifically to, so that those tests that have a little bit right now, more rapid turnaround, is safe for those who really need the test, and I don't mean financially, those who fit criteria that make us very concerned that they could communicate the disease to others.
Thank you.
Any further questions? No? Well, thank you, Dr. Anscher. Thank you, Mr. Meisner. I appreciate coming out today.